How to use and operate a concentrator. So for those who don't know, a concentrator is an alternative for an oxygen tank. An oxygen tank average lifespan is usually 2 hours. Concentrator can go forever and ever because it is plugged into the wall and it uses the air to formulate good oxygen for the patient. So how do you turn this thing on? So basically at the top, you see there's a button here and you flip it the other way and it turns on. Okay, so what else do these things do? How do you put the amount of liters, which is the amount of oxygen that you can use? So here is where you would read it, right? So wherever the black ball is indicating how much oxygen liters is being pumped. So let's turn it back on. So it was set to, as you can see, actually 3. It needed a little time to work. So this lever here, turning it moves the black ball to the liter that you want to do. So remember, 2 liters is what you're allowed to give a patient without an order. Anything above 2 liters, you need an order. So yes, and where do you put the nasal cannula? You put the nasal cannula here. Another tip, you could imagine that pumping oxygen in someone's nose could be very drying over time. So you could actually hook up a humidifier to the concentrator in order to add moisture so it doesn't dry out their nose, cause nosebleeds. You know, and especially with our dementia patients, they might rip off the nasal cannula and you're like, why won't you keep it on? Because it hurts. Sometimes it hurts. So that's it.